The St. Mary's Way describes our community as a place where people take individual responsibility for their work and actions, where we foster relationships based upon mutual respect and trust, and where we contribute to a spirit of caring and an ethic of service. These values and actions apply to everything we do as a campus community, including how we keep ourselves and one another safe from the coronavirus. This training will help you take responsibility for your own safety and the safety of your community. Welcome to the COVID-19 Hygiene Best Practices online training course. This course is intended for all faculty, staff, students, and other members of the St. Mary's community. The purpose of this training is to increase health and safety awareness for campus on ways to protect yourself and others from exposure to novel coronavirus that causes the disease COVID-19, to establish general health and hygiene rules, and to understand policies and procedures in case you contract COVID-19. For more information, visit the SMCM Reopening the St. Mary's Way website, available at https://www.smcm.edu/reopening-smcm. After you complete this training, you will be able to explain basic facts about COVID-19, identify methods to reduce exposure to COVID-19 on campus, implement general health and hygiene rules, and understand policies and procedures in case you contract COVID-19. This course is expected to take approximately 20 minutes. First, let's discuss the basic facts about COVID-19. Coronaviruses are a family of viruses that typically cause mild respiratory infections, although they can result in more severe disease, as seen in past years with related viruses. Coronaviruses are common in people and many different species of animals, including cats, camels, bats, and cattle. The coronavirus that causes COVID-19 is a new strain, meaning that it has not previously been found in humans. As a result, humans have not developed immunity to COVID-19 and therefore can be infected. Its health impact is currently being closely monitored internationally, nationally, and locally by the World Health Organization, the Centers for Disease Control and Prevention, and local county health departments. The novel coronavirus SARS-CoV-2 is a new respiratory virus first identified in December 2019. The virus has been named SARS-CoV-2, and the disease it causes has been named Coronavirus Disease 2019, abbreviated COVID-19. Throughout this training, we refer to the virus as coronavirus and the disease as COVID-19. Spread of the coronavirus, the virus that causes COVID-19, is thought to occur in the same way that seasonal flu spreads. Person-to-person spread is the primary source of transmission. Close contact with respiratory droplets is the main source for transmission. Transmission of the coronavirus is also possible from individuals who are not showing any symptoms of the illness. This is why washing hands with soap and water and practicing social distancing are crucial to reducing transmission. Surfaces and objects may be contaminated with the coronavirus. Shared equipment, such as pipettes, keyboard and mouse, phones, and writing utensils, are examples of surfaces and objects that could be contaminated. It may also be possible to contract COVID-19 by touching a surface or an object that has the virus on it and then touching one's own mouth, nose, or eyes. Symptoms of COVID-19 can include cough, fever, chills, sore throat, shortness of breath, or difficulty breathing, new loss of taste or smell, or muscle pain. Milder symptoms include a sudden onset or change in smell or taste, or more than one of the following: fever or chills without fever, sore throat, mild cough, persistent headache, mild fatigue and muscle ache, nausea or diarrhea, or an atypical skin rash. Moderate to severe symptoms include any one of the following: fever greater than 100 degrees Fahrenheit, or persistent dry or wet cough, wheezing or trouble breathing, moderate muscle aches, or chest tightness. People with COVID-19 have reported a wide range of symptoms, ranging from mild to severe illness. Approximately half of symptomatic patients do not initially have a fever. Symptoms may appear 2 to 14 days after exposure to the virus. Those at higher risk for severe illness from COVID-19 include people who are 65 years and older, those living in a nursing home or long-term care facility, or people of any age with underlying medical conditions, particularly if the medical conditions are not well controlled, including chronic lung disease or moderate to severe asthma, or serious heart conditions, or people who are immunocompromised, severely obese, diabetic, or people who have liver disease or chronic kidney disease and are undergoing dialysis. See the link at the end of this presentation for more information from the CDC about underlying medical conditions. Each student and employee will receive an SMCM drawstring bag containing enough masks, gloves, and sanitizer to last throughout the entire fall semester, as well as an individual thermometer for daily personal temperature readings. The college will require ongoing self-monitoring of symptoms for residential and commuting students and employees who will be on the campus at any point during the semester. Faculty, staff, and students with symptoms of coronavirus should stay at home or in their dorm rooms, except to get testing or medical treatment, and stay separate from others. If you are experiencing symptoms, call the Wellness Center 240-895-4289 during work hours from 8 a.m. to 5 p.m. Call the 24/7 helpline 240-895-4200 during non-work hours, or contact a personal healthcare provider. Call 911 if you're experiencing acute symptoms, such as pain while breathing and chest pressure. Testing is available for symptomatic faculty, staff, and students through the Wellness Center during regular business hours. Next, let's look at reducing exposure to COVID-19. Here, we will explore how you can embody the spirit of caring and the ethic of service that define our community by taking individual responsibility for the health and safety of all members of our community. You can do this by wearing a face covering and practicing social distancing. According to guidance from the Centers for Disease Control and Prevention and the St. Mary's County Health Department, the use of a face covering can potentially slow the spread of COVID-19 by preventing people who may have the virus but are asymptomatic from transmitting it to others. Face coverings are not a substitute for social distancing or hand-washing hygiene. All faculty, staff, and students must wear face coverings while on campus. This includes buildings, grounds, classrooms, shared laboratory areas, conference rooms, elevators, hallways, and other spaces. Face coverings must cover the mouth and nose at all times, except when you're eating or are alone in a private room or vehicle. Face coverings should fit snugly but comfortably against your face, be secured with ties or ear loops, and include multiple layers of fabric. When using a face covering, wear it whenever you're going out in public. Make sure you can breathe through it and that it covers your nose and mouth. Wash and machine dry a face covering after each use. Do not use face coverings on children under age 2. Do not use surgical masks or other personal protective equipment intended for healthcare workers. When removing face coverings, do not touch your eyes, nose, or mouth, and wash hands with soap and water, or use hand sanitizer after removing your face covering. Individuals who cannot wear a protective mask due to a medical issue, such as trouble breathing or the inability to remove the covering without assistance, should seek accommodations by contacting the Office of Human Resources for faculty and staff, or the Office of Accessibility Services for students. Individuals whose job duties may present a hazard if performed while wearing a face covering or mask, such as entanglement hazards, should speak to their supervisors. The supervisor will advise on whether wearing a face covering or mask is permissible while performing such work. The supervisor may determine that additional instruction is needed to ensure the safe use of a face covering or mask while performing work tasks. Next, let's talk about social distancing. The goal of social distancing is to reduce transmission of the coronavirus. CDC describes it as common sense approaches to limiting face-to-face contact, but it is not intended to completely eliminate all interactions. SMCM community members must maintain at least 6 feet of social distance, about 2 arms lengths, from others wherever possible, even during breaks, when you're eating lunch, or in casual interactions with friends or coworkers. Individuals are required to follow any signage or instruction regarding gatherings, the use of common spaces, hallways, or pathways through campus. All managers and supervisors must develop a plan for facilitating and implementing the social distancing of employees utilizing resources and guidance provided by the college. And be sure to report to Public Safety 240-895-4911 any locations or examples of social distancing congestion to assist with identifying potential problem areas. It's important to remind ourselves that campus won't always be this way and will eventually have vaccines and effective treatments for the coronavirus. But for now, it's up to each of us to keep our community safe. Please know that failure to adhere to the college's risk mitigation measures will result in disciplinary action, up to and including removal from campus. Next, let's discuss rules for general health and hygiene. First, all employees and students must refrain from visiting campus or facilities whenever you are sick or have symptoms of respiratory illness. SMCM community members should monitor their temperature and health at home every day using the SMCM Daily Attestation tool through Qualtrics. If you experience any symptoms of COVID-19 or any other respiratory illness, do not report to work or class in person until the symptoms are no longer present, and as directed by the St. Mary's County Health Department and the Centers for Disease Control and Prevention guidance. See the CDC link at the end of this presentation for a current list of symptoms associated with COVID-19. Wash your hands frequently for at least 20 seconds, preferably with soap and warm water, particularly after coming into contact with high-touch surfaces like doorknobs, handrails, and commonly used equipment. There are 5 steps to proper hand washing. First, wet your hands with clean, running water, warm or cold, turn off the tap, and apply soap. Next, lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers and under your nails. Scrub your hands for at least 20 seconds. Rinse your hands well under clean, running water. Dry your hands using a clean towel or air dry them. When soap and warm water are not immediately available, use hand sanitizer containing ethanol, ethyl alcohol, or isopropanol, isopropyl alcohol, or use sanitizing wipes. Do not use hand sanitizer containing methanol, methyl alcohol. Be sure to cough or sneeze into your sleeves, preferably into the elbow. When using a tissue, discard it properly into a wastebasket or plastic bag and clean or sanitize your hands immediately. Avoid touching your face, particularly your eyes, nose, and mouth, with your hands to prevent infection. Clean and disinfect frequently touched objects and surfaces in your personal workspaces. Employees, before leaving work each day, clear your work surfaces of paper and other materials to allow for proper cleaning by facility staff. Finally, we'll look at what happens if you contract the coronavirus, as well as some specific health reporting requirements related to COVID-19. If you are experiencing any symptoms of COVID-19 or other respiratory illnesses, such as cough, shortness of breath or difficulty breathing, fever, new loss of taste or smell, sore throat, muscle pain or body aches, headache, or chills, you may not report to work or class. If you have COVID-19 symptoms, call the Wellness Center to arrange for testing on campus or testing through the St. Mary's County Health Department at St. Mary's Hospital. Residential students must self-isolate in designated on-campus housing while awaiting their test results. Commuter students should remain at home pending the test results. Employees who experience an onset of symptoms while at work must leave campus immediately. Staff should contact their manager and the Office of Human Resources to request leave. Faculty should contact their department chair or coordinator. Student employees should contact their work supervisors. Employees who are unable to work due to personal illness should use available sick time. If an employee's available sick time has already been exhausted, they should contact Human Resources to discuss available leave options. Employees who are unable to work due to COVID-19 should review the college's Families First Coronavirus Response Family Medical Leave and Sick Leave policy. Contact Human Resources to submit documents for leave under the policy and to ask any questions. All employees are required to report to their department chair, coordinator, or supervisor if they have any positive test for COVID-19 or if they are in voluntary self-isolation due to a suspected exposure to COVID-19 or the presence of symptoms of a respiratory illness. In the event of a positive or suspected COVID-19 diagnosis, employees are required to cooperate fully with the college's protocols for self-isolation, contact tracing, and notification, which are aligned with the St. Mary's County Health Department and the Centers for Disease Control and Prevention. Please know that any employee's health information, which is reported under this policy, will be shared only with those who need to know to assist with contact tracing requirements. Be sure to complete the COVID-19 Hygiene Best Practices Training completion form, available at https://www.smcm.edu/safety. You are required to complete this training and the completion form before you return to campus. Together, we can embrace the St. Mary's Way and keep ourselves and our community healthy by maintaining social distancing, wearing face coverings, washing hands frequently and thoroughly, and engaging in general health and hygiene practices. Thank you for taking the time to complete this course, and please check the SMCM reopening page frequently for updated information.